Every day we see the people around us getting sick, and one of the most common health issues today is altered blood pressure. You certainly know someone who has either high or low blood pressure. Even you might have it. But how can we identify a drop or raise in blood pressure? Blood pressure, BP, is nothing more than the system that transports blood through the heart and arteries to the brain and other organs of the body. Regular blood pressure is 120/80. If the numbers are above this, 140/90 or higher, we call it hypertension, high blood pressure. If they are below 90/60, it is a case of hypotension, low blood pressure. A way of differentiating between high and low blood pressure is by the symptoms. When it is low, we feel a fainting sensation, weakness, drowsiness, blurred vision, and dry mouth. If your BP is high, you might get double or blurry vision, ringing in the ears, heart palpitations, persistent headaches, and pain in the back of your head. But when we are in a remote area and without a BP machine close by, there is no way of knowing if our BP is altered. Of course, the symptoms may help in this case. But if you were ever caught in this situation before, you know what I'm talking about. To check your BP without a machine, all you need is a simple test. Are you enjoying the video? Then don't forget to leave a like and share it with your friends to help the channel. Stand up close to a wall or tree. Press the upper part of your hand on the wall and count 60 seconds. After this time, release your hand and your arm will automatically move. If your arm goes below your shoulder, your BP is low. The arm at the same level of your shoulder means normal blood pressure. If your arm goes above the shoulder, your BP is high. Try this method for a quick check, but don't forget to schedule a visit to your doctor to investigate the causes of your altered blood